This lecture covers the fourth part of Chapter 8, the integumentary system. It covers pathology and medication delivery. Different lesions on the skin can be described with specific terminology. A macule is a flat, discolored spot on the skin, such as a freckle. A wheal is a localized elevation of the skin that is often accompanied by itching. This is like hives or urticaria. A papule is a solid, circumscribed, elevated area on the skin, and an example of this is like a mole, which is raised. A nodule is like a papule, but it's larger. This is like acne vulgaris, the type of acne that is under the skin and doesn't have a head on it. A vesicle is a small, fluid-filled sac, like a blister. A bulla is a larger vesicle. So if you remember in the previous lecture, the person who had the sunburns on their legs, those large pockets of fluid were more like bulla than a vesicle. A pustule is a small, elevated, circumscribed lesion on the skin which is filled with pus, and this is like a small pimple. An erosion is an ulcer. A crust is a dry, scaly part of the skin, usually by an exudate, like if someone has impetigo, they get honey-colored crusting on the skin. A scale is a thin, dry flake of cornified epithelial cells, so hyperkeratinized cells. You can see this in psoriasis or in eczema. Oftentimes, fungal infections of the skin will be scaly. And a fissure is a crack-like sore or slit that extends through the dermis into the dermis. So when someone has a really bad fungal infection, the skin can actually crack, like an athlete's foot. Herpes is an incurable viral infection which causes inflammation in vesicles. Herpes simplex virus can be anywhere on the body, but type 1 is on the lips and type 2 is typically on the genitals. Herpes varicella, which is also known as chickenpox, is an airborne virus which causes widespread vesicles on the body. And this is actually something that is now you can vaccinate babies against this disease. When a person gets herpes varicella, they later can get herpes zoster, which is shingles. Herpes varicella will lay dormant in the spine and become active during moments of immune suppression, like if someone is very stressed or if they're very ill. And when you erupt in the vesicles that are associated with herpes zoster, it follows a specific nerve root distribution. So if you can see this little man down here with the stripes on him, each spinal nerve exits the spine at a specific level and innervates a specific swatch of skin. And when you get herpes, when you get shingles rather, you'll break out in a specific swatch of skin called a dermatome. Warts, or also known as verruca, are hyperkeratinized lesions of the skin caused by the papillomavirus. Plantar warts are on the bottom of your feet. Genital warts are a sexually transmitted infection which is caused by human papillomavirus. It is associated with cervical cancer and they actually have recently developed a vaccination against this infection as well. Tinea refers to a general term for an infection of the skin or nails by a fungus. Tinea pedis is a fungal infection of the feet, like athlete's foot. Tinea cruris is a fungal infection of the groin, like commonly known as jock itch. Tinea corporis is a fungal infection of the body, like ringworm. And tinea unguenum is a fungal infection of the nails. So you can see the gentleman at the top has a fungal infection of the skin. That would be tinea corporis. And this fungal infection of the nail would be tinea unguenum. Cellulitis is a bacterial infection of the skin. It's usually caused by Staph aureus, which is a bacteria that just sort of colonizes our skin. If the cellulitis is associated with pockets of pus, it can be indicative of MRSA or methicillin-resistant Staph aureus. It requires treatment with antibiotics. So you can see that the right leg of this patient is affected by cellulitis, which is a bacterial infection of the planes of skin. Lyme disease is a systemic infection caused by bacteria Borrelia, which is carried by ticks. The patient generally has flu-like symptoms, joint pain, and fever. It can affect the nervous system and the heart. And the first sign of this infection is a targetoid lesion, which resembles a bullseye. Jaundice refers to a yellowing of the skin and eyes due to a high bilirubin level in the bloodstream. This can be from liver failure, in which the liver does not process the bilirubin. It can be from biliary disease, in which a gallstone or a tumor obstructs bilirubin from passing from the gallbladder into the GI tract. Or it can be from hemolysis, which is bursting of the red blood cells, causing the bilirubin to go up in the bloodstream. And you can see that this gentleman has a very yellow color to his skin. So medication delivery. The skin can be a very effective way of delivering medications. You can deliver them transdermally, which means across the skin. These are usually patches, like nicotine patches, gels. There's different testosterone gels or pain-killing gels or creams. Sublingual means under the tongue. The skin under the tongue is very vascularized, and it's a really good way to deliver medication because it's rapidly absorbed, and also you don't have to use the GI tract. Subcutaneous is under the skin, so this is like injections, like insulin or lidocaine, and implantation like the Nexplanon, which is actually a form of birth control. And then intradermal means the medication is delivered into the skin within the dermis.